What if I told you that high blood pressure is not primarily a salt problem, and that for many people, high blood pressure is reversible, not controlled, not masked with medications, but actually improved at the root cause? Today, I'll talk about how to fix blood pressure naturally and safely based on real metabolic science. And I want to be very clear, this is not about ignoring blood pressure medications when clinically indicated and needed. This is about understanding why your blood pressure is high in the first place and what you can do about it. What is high blood pressure? High blood pressure or hypertension means the force of blood pushing against your arteries is consistently too high. Normal blood pressure is 120 over 80. High blood pressure is diagnosed when readings are consistently 130 over 80 or higher. Now, here's something important. Blood pressure is not just about your heart. Blood pressure reflects artery stiffness, hormonal balance, kidney function, insulin levels, stress levels, and sleep quality. So, when blood pressure rises, it's usually a signal, not just a random number. And that brings us to diagnosis. How is high blood pressure diagnosed? Remember, one single high blood pressure reading at doctor's office does not mean you have hypertension. White coat hypertension is real. White coat hypertension occurs when your blood pressure readings are high in a clinical setting, like in the doctor's office, but normal in your everyday life. White coat hypertension is typically triggered by the subconscious stress or anxiety of being in a medical environment. Let me know in the comments if you have had high blood pressure in your doctor's or dentist's office but normal blood pressure at home. So for diagnosis of high blood pressure, you need multiple readings, ideally home blood pressure monitoring, proper technique, which means seated position, resting for at least 5 minutes, legs uncrossed, feet flat on floor, and no talking while checking your blood pressure. Many people are misdiagnosed and many are underdiagnosed. That's why I always tell my patients to know your blood pressure numbers. How common is high blood pressure? Nearly half of adults in US have high blood pressure and most don't feel it. And that's why it's called a silent killer. But here's the key. Most hypertension is metabolic hypertension, which leads us to something critical: the connection of blood pressure and metabolic health. High blood pressure rarely exists alone. High blood pressure often coexists with insulin resistance, prediabetes, type 2 diabetes, visceral or belly fat, fatty liver, and high triglycerides. High blood pressure is part of the metabolic storm. And now let's talk about how to fix high blood pressure with 8 proven natural ways to lower blood pressure. These are not internet hacks, these are backed by clinical research. Number one, fix insulin resistance by lowering refined carbohydrates, lowering added sugar, and lowering ultra processed foods. When insulin drops, blood pressure often follows. Even 5 to 10% of weight loss can significantly reduce blood pressure. Number two, increase potassium intake. Potassium relaxes blood vessels. Most people are potassium deficient, not sodium overloaded. Foods like avocado, spinach, beans, banana, citrus, yogurt, and salmon are rich in potassium, and including these in your diet can help your blood pressure control. But if you have kidney disease, talk to your doctor first before increasing potassium in your diet. Number three, magnesium repletion. Magnesium helps relax blood vessels. Magnesium deficiency is extremely common. Low magnesium equals vascular or blood vessel constriction. Magnesium-rich food sources are pumpkin seeds, almonds, dark green leafy vegetables. So incorporating these in your diet can be helpful, especially if you have low magnesium. Some people may benefit from magnesium supplementation, but it's best to test and discuss first with your doctor. Number four, improve sleep. 8 hours of uninterrupted sleep is key for good metabolic health. Sleep deprivation raises cortisol, sympathetic tone, and blood pressure. If you snore or wake up tired, consider consultation with your doctor for sleep apnea screening. Untreated sleep apnea can cause resistant hypertension. Number 5, reduce fructose and liquid sugar. High fructose intake raises uric acid, impairs nitric oxide, and stiffens blood vessels. So avoid soda, fruit juices, and sweetened drinks. Whole foods are usually fine in moderation. Liquid sugar is mostly problematic. Number 6, resistance training and walking. Here's the simple fact: you don't need marathon cardio. Studies show that 30 minutes of brisk walking most days and 2 to 3 days of strength training sessions per week can help significantly lower blood pressure. Remember, muscle improves insulin sensitivity. Number 7, vitamin D optimization. Low vitamin D correlates with hypertension. Vitamin D deficiency is especially common in indoor workers, darker skinned individuals, and those with obesity. Vitamin D deficiency is extremely common. Testing for vitamin D is especially helpful if risk factors exist, and correcting with supplementation can help improve metabolic health. Number 8, stress reduction. Chronic stress activates adrenaline and cortisol and causes blood vessel constriction. Some ways to reduce stress are breathing exercises, nature exposure, faith practices, meditation, and community connection. Stress management is not soft science, it's vascular science. So, is salt irrelevant? No, salt does matter, but mostly in salt sensitive individuals. And who is salt sensitive? Mostly older adults, African Americans, those with kidney disease, and insulin resistance. For metabolically healthy people, moderate salt intake is usually fine. The real issue, however, is ultra processed foods where sodium, sugar, and seed oils coexist. What are the warning signs of high blood pressure? Most people have no symptoms, but concerning signs include headaches, blurry vision, chest pain, shortness of breath, swelling, blood pressure readings above 180 systolic. These are all concerning symptoms and should lead to urgent medical evaluation. Do you need labs? Labs can be helpful. Consider fasting insulin, hemoglobin A1C, lipid panel, CMP, magnesium, vitamin D, uric acid, TSH. If blood pressure is severe or resistant, then consider evaluation for aldosterone, renal artery stenosis, and other endocrine causes. When in doubt, it's best to seek medical advice from your doctor. Let's talk about some myths. Myth is high blood pressure is just genetics. Fact is, genetics load the gun. However, lifestyle pulls the trigger. Another myth is, I feel fine, it's not serious. Fact is, damage from high blood pressure happens silently. Another myth is, natural means safe for everyone. Fact is, even supplements need medical guidance. So, what are questions you want to ask your doctor at your next blood pressure visit? Is my hypertension metabolic? Am I insulin resistant? Could sleep apnea be contributing? Are my medications worsening metabolic health? What labs are appropriate for me? Can I try lifestyle intervention first? Let me ask you, have you ever improved your blood pressure naturally? Comment below as your story might help someone. Here is an important clarification. If your blood pressure is very high, especially if causing symptoms or you have heart or kidney disease, then do not stop your medication suddenly. Any change in your medication should be with close consultation with your doctor. Lifestyle is powerful, but safety comes first. Here's what I want you to remember. High blood pressure is often a symptom, not a life sentence. And for many people, high blood pressure is reversible, or at least can be improved dramatically when you fix the metabolic root. If this video was helpful, please like, subscribe, and share it with family and friends who may benefit from this information. Remember, your blood pressure number is not your identity. It's a signal for your metabolic health. Let's fix the signal. Stay happy, healthy, and well. Bye for now.